It's our first day in the clinic. It's actually Sunday, and they were nice enough to bring staff in for us. I think you saw the waiting room is absolutely packed with people, a lot more than we expected. So we're hoping to get people set up for surgery on Monday. We're not able to operate today because it's Sunday, but we're going to at least get started tomorrow. And what we'll do is examine people and get them all set up, make sure that cataract is their visual problem and it wasn't something else. Every once in a while, you'll see an eye that went blind for some other reason. You don't want to do cataract surgery if it isn't going to help. So that's what John and I are trying to determine today. We're trying to figure out the best way to go about seeing all these people. As I was saying earlier, there's always some element of chaos when you get started on these things because everyone wants to get seen, and we have to figure out how we're going to get them through here and get them all seen timely.
Normally we've got time to several months to get the word out that we're coming down with a team. We only had 24 hours with this, but still, since we've been down here in the past, they were able to get the word out pretty well. And we've got, take a look. This is just the first day. There's probably 40 or 50 people out here, and we're trying to line up the first 10, and we're going to examine them for the cataracts, measure them for cataract surgery, and plan to do most of these people's surgery tomorrow. And every day should be very similar to this, in the fact that hopefully we'll have about 40 patients to operate on every day. So it looks kind of crazy, but it's pretty rewarding. Some of these people have been blind for 5 and 10 years and longer than that. They just haven't had any opportunity.
Room where they will be blocking the eyes so that they can go into surgery. So Dr. Pica is right now getting the first person blocked.
The thing that I think is always striking is that in the United States we don't usually use injection. This hurts pretty good, and every time I've come to Nicaragua or other developing countries where the folks have lived a pretty hard life, I'm amazed at how when we give these shots around the eye, they just sit there and they hardly make them move. They don't whine, they don't cry, they don't scream. And if we did this to folks in the States, it's a totally different experience. Just sort of goes to tell how hard a life they've lived, that they can just take this. It's fairly easy with all of our technology, but unfortunately the technology is fairly expensive, and it's very difficult for poorer countries to have this technology. But the nice thing about Nicaragua is, by making donations of the basic equipment, they're able to do a lot of their own surgery.